always is placement.
Yes.
That's the answer for everything.
Right.
So how do we check placement at St. Joe's?
30 cc's of air.
30 cc's of air, and where do you put your stethoscope?
Right on
Quadrant.
Yeah, left
upper
upper
left.
quadrant. And I can tell you that when you go to check that, you're gonna wanna whoosh really fast. Don't be gentle or slow, you wanna whoosh. And it's really hard to whoosh and put your stethoscope. So I always, either I hold the stethoscope for the student or I just lay it there and concentrate more on the fast whoosh. So then you hear it, so you know you're in there. So for irrigation, you do want to aspirate and look to see what's going on with the stomach contents. What is it that's in the stomach? Because you want to check for, you know, frank blood. So you do check that and you refeed that in so you don't interrupt their electrolyte imbalance. All of that stomach content, though gross, is got full of electrolytes. So you put that back in, you uncap that, you pull up your 60 cc's of saline if there's a specific order, or 30 cc's, hook it back in and you flush it in, pull it out, and you discard of that. Okay? You're discarding that because it's got something, the reason why you're doing that is to pull something out of the stomach or to clear the tube. Now the tube's either going to be clamped when you're done or hooked back up to suction. If your patient's on suction, you're not going to be able to hear that whoosh if you've got the suction machine because it's very loud.
Right.
So you want to turn that off. But that's all it is for irrigation.
Okay.
All right. Now normally you wouldn't just irrigate once. Usually if it's ordered, you got to irrigate it more than that to clear the tube or to get rid of that blood that's in there. But for us, for the competency, you just have to do it once.
Okay.
What you have to make sure is you do it in order and that you keep the whole process as clean as possible. It can't be sterile. And that you wear the appropriate protective equipment. What would you want to have on for that?
Face.
Gloves and a face shield, yeah. And you'll never see nurses wearing them, just want you to know. The gloves, yes. The face shield, no. So tube feedings generally are run on a pump. But for the competency, oh, she's taking me again. That is a bolus feeding. Generally, bolus feedings aren't used, and I think I said this before, because then they get this large volume of formula in. But for this, you have to learn how to do that. And they do use bolus feedings for infants. That's more the likelihood than it would be for a continuous pump feeding. So the first thing you're going to do after you get your personal protective equipment on for a tube feeding, either naso or G tube, would be what?
Check placement.
Check placement. If they have a J tube, and I know this is above and beyond, but you don't have to check placement because that's sutured in there. So for the G tube and the NG tube, and this guy is going to have this guy and gal are going to have NG tubes for you. You check placement, then you're going to check residual by aspirating. And what are you checking for when you aspirate?
Color and what is there?
It's mainly the amount.
Yeah.
It's mainly the amount. And we're not going to ask you this, but you need to know that up to 100 is okay. 100, after 100, you got to talk to the doctor. If you get more than 150 or more, you're going to hold the feeding. And when we've done it in the past, we've gotten like 4 syringefuls of feeding. We're like, well, this person's not absorbing that, so we're certainly not going to give them more feeding to make them even more full.
So you keep drawing up until there's nothing else coming.
Right. And you put that somewhere. You put it in a clean area, like a clean, one of these containers, or we've used styrofoam cups, because you're going to refeed back 150, and you're going to toss out anything above 150. That is specific to St. Joe's, so if you practice somewhere else, you would have to, go by what their policy is, but it's very confusing. Even when I do it on the unit and we have more than 150, I usually have the policy right with me. So say you're in the competency and you pull back and you say, I've only got 30 cc's. Okay, great, let's proceed with the feeding. So then you're going to keep the inside of that syringe, you're going to take it out, because we're going to do gravity.
Yeah.
Yeah, and you're going to put that in a clean area, not on the table.
Oh, okay.
You're going to hook that up, you're gonna pour in, say it's gonna be 30 cc's of formula, you would pour that in. Actually, it's flush, feed, flush.
Yeah, isn't it tap
I'm sorry,
water?
Tap water. So it's flush, feed, flush, if you can remember that. So you put in your amount of tap water, your amount of feeding, and then your amount of tap water. And hopefully, I'll ask Mrs. Kwazik, we'll have the feeding water colored so you know you have difference.
It was yellow in lab.
Okay.
Yeah.
Yum, 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 yum. And I always tell the students, anyone, that you want to have that tap water room temperature. You don't want it too hot, too cold. So we're going to watch you do the flush, feed, flush, and that you
Okay.
hook everything back up using clean technique.
Okay. What do you want me to use for the flush?
You can just pretend all you want.
Yeah.
Yeah.
Alrighty, because since the flush is a specific 30 cc's, I should do this with it together so I drop the right amount.
You can do that, or
You
there's
can.
markings on the.
Right, but wouldn't it be going through
No,
so you
clamp
wouldn't?
it. You have to make sure your tube's
Oh, you
clamped.
clamp this. Okay. Alrighty.
And the clamping is pinching.
Yeah, just pinch
Just-
it. Yep.
Just
Yeah.
pinch it like that. Okay. Alright.
Now, I don't want to confuse you, but on the clinical unit, we have three-way stop cocks, but here
Okay.
you do this.
Just to do this. Okay. So, alright. So
So
we're
you're
gonna
doing-
30 cc's of tap water. Okay.
And your patient is so helpful to you because he's got a nice big tube that's nice and clear. That doesn't happen.
No.
Yeah.
Okay.
We hope it would happen, but
So we
sometimes it
clamp
doesn't
it
happen.
again before you feed.
You would do the clamp before you feed it,
Clamp and then
and
pour
then
the feed
pour.
in.
Mhm.
So,
So
we'll
the feed's
just say
100?
that.
Let's just say is there 50 marks on there?
Yeah, there is.
Let's do a 50.
Do 50. Okay, let me.
And
just-
you would tell us like on how much.
How much for the feeding?
Or you could tell me and I'll remember for Thursday. How's that? Oh no, it's next Thursday.
Yeah.
This Thursday
Okay.
we're eating turkey.
All right, so that's
True.
50 cc's for the feeding.
Okay, it's already in there, so do I have to worry about sterile anymore?
What you do want to hold on to the catheter while you're.
So is it always 30 cc's for the tap water, no
For
matter what?
flushing,
For
yeah.
flushing, it is. Yeah.
At St. Joe's, yeah.
Okay, and then 30 more cc's
Right.
to flush again.
Once you see urine, how much further would you?
And you're doing feeding.
Yeah.
To what?
Okay. And then that's the 30 cc's to flush again.
Yeah.
And remember, in any of these lab practicals, if you make a mistake, as long as you're not making multiple mistakes, but if you make a mistake and you verbalize it, say you get your sterile field wet when you're doing your wound care, if you say, okay, if I was on the clinical unit, I would stop and start all over again, then we don't, as long as you can tell us what you did. Now, if you keep doing everything wrong during the wound, then that's a whole different story.
Okay.
If you don't pass your validation, whatever we're calling it, your lab practical, because of nervousness or whatever, you get another chance. And you do the exact same skill again. So while I can tell you don't be nervous, you're all going to be nervous. So that's just. But I like your idea of the cards, so that you can say, okay, my skill. Over the break, go, okay, I'm going to just go over in my head what I'm doing. Do. Okay, for this one, do. I think the hardest one to get is the IV one. Because there's so many steps. You're going to have to calculate, you're going to have to flush, you're going to have to connect, you're going to have to discontinue, so there's lots and lots of steps to the IV one.
Right.
This one actually isn't that bad, it's just that you don't get a chance to use the equipment very often.
And we learned it so early in
Yeah.
the
Yeah.
semester
We learned it
too.
quick.
Yeah.
Yeah.
So, okay. So then for the irrigation, we're gonna do 30 cc's of air.
And if you picked tap water for the irrigation instead of normal saline, that would be an issue.
Right.
Right.
For both, you ask for it,
Mhm.
but for irrigation, you throw it away. flush, you put it back. For feeding, you put it back in.
If it's less than 1,
Yeah.
For the aspirating at the beginning, you put it back in. But when you flush it and you suck it back, you throw that part away.
Okay.
Does that make sense?
Yeah.
Okay.
Alright, so for irrigating then, we're gonna instill the 30 cc's of air. And I'd be listening for in the upper left quadrant. Then we're gonna take 30 cc's.
You gotta aspirate first.
Oh, I'm gonna forget that. No. So nothing's coming up,
Yeah.
but that's not in anything. So we'll just assume that whatever needed to come up did, and we would put it back. Okay. Then it's draw 30 milliliters of solution.
Did you put the clamp back on it?
Yeah, just always remember you gotta reclamp it, but your clamp's broken.
Right.
So.
Yeah. So I don't know if I have enough in here to do this.
You could just guesstimate and pretend.
Yeah.
Okay, that's almost 30 cc's. So then, gonna do this slowly.
is that normal saline?
For irrigation, it would be normal saline. Yeah. And then I'm gonna withdraw 30 milliliters of solution, right? With the irrigation, that's what I've written down. I don't think anything. Oh, it is gonna come up. I must have enough in there now. Wow, I didn't get it, but it's not in there still. And then with the irrigation, do I put this back?
No, you throw.
No, this
that's
you
when you
throw
toss away
away.
because
Yeah.
your irrigating's cleaning it out. So you
Yeah.
want to
Right, you don't wanna
clean
So
the
whatever you
So
pull
when
back
you
gets thrown away.
is that like the checking the residual and then you throw it away?
No, that's for feedings. You check the residual. For irrigation, you're just cleaning out the tubing and.
But what is the 30 milliliters that you took out? Just to, what is that for?
Because that's what you're trying to get out of the tube to
Yeah.
clean it.
Oh, okay. And then you can put it back in.
Yeah, 'cause she-
Not
because she put the water in,
Yeah.
and then now she's taking out whatever's blocking or in the way.
Yeah,
to
and then this
remove
will be
it.
discarded.
Yeah,
I'm
that
gonna
would
put
be
it back in just for our purposes.
But you would like discard it and everything?
Yeah.
Yeah.
Discard it, yeah.
All right. Somebody else.
I think you
wanna-
can discard it anywhere, really. Maybe go to the bathroom first before I do